Thank you very much. I agree with you that the case of flavors tobacco harm reduction is a very controversial topic. In fact, in general, mostly electronic cigarettes, but also all harm reduction products are a highly controversial topic. The reason is that we are seeing strong and opposing views in the scientific community, but also among the regulators and within the society about the prospective impact of e-cigarettes and all other products on smoking rates and on public health in general. And flavors has been traditionally a very hot topic, with many expressing concerns about the youth use and getaway to smoking effects for flavored products, mainly electronic cigarettes. So I will start by looking at what's happening with youth vaping in the US. There has been a lot of debate. It has been called the vaping epidemic in the US by the authorities, the CDC and the FDA. However, it's not exactly that. We have published data from the National Youth Tobacco Survey, in that case 2017 and 18. I should know that today the use of e-cigarettes among youth is lower than at that time. It peaked at around 2019, and then it started weaning off. But even in that, at that time, when you look at adolescents who have never smoked in their lives, there was no history of smoking. The vast majority were not current cigarette users, of course. The rest were mainly showing infrequent use. Infrequent use, according to the definition of the survey, was use of less than 20 of the past 30 days. And frequent use was around 1% in 2018, which included 0.5% daily use. So the 0.5% is included in the total proportion of frequent use, which was 0.9% among never smoking adolescents in the US. Concerning the getaway to smoking effects, I think this has been largely rejected by the data, and these are official CDC data. When you look at the smoking rates before the growing popularity of electronic cigarettes and today. So in 2011, where electronic cigarettes were not widely available and the popularity was not at the level that it is today, the smoking rates among middle school students was 4.3%, and among high school students in the US, 15.10%. And you see that there is a dramatic decline in smoking rates. So in 2023, the latest data are showing basically that the next generation of Americans is going to be a smoke-free generation. The smoking rates have almost eliminated, 1.1% in middle school students and 1.9% in high school students, almost 10 times lower compared to 12 years ago. So this, I think, largely rejects the getaway to smoking hypothesis and claims that we are hearing for many years now concerning the use of vaping products, particularly flavored vaping products. And when you look at general long-term trends, there has been an increase in the rate of decline of smoking starting at around 2010. So starting at the point where when electronic cigarettes started appearing in the market and having growing popularity. So this is another kind of evidence showing that the getaway to smoking effects is rather not valid and not applicable in this case. But concerning flavors, everyone is talking about flavors that are attracting youth. But are flavors appealing to adults? This is the main question. Why do flavors exist? Well, a systematic review of 104 studies published 2 years ago identified that there are two main factors that are associated with the attractiveness of electronic cigarettes for smoking adults. This is extremely important. The two factors were higher nicotine concentrations and access to a variety of flavors. And the authors mentioned that these two factors are likely to be associated with higher abuse potential and appeal for electronic cigarettes for adult, current, and former smokers. I need to emphasize that. And someone may think that when you read the sentence about abuse potential and appeal, that it's something bad, that it's something concerning. However, this is not the case. It is exactly what smokers need. Smokers need an alternative product that is appealing, that is attractive, which means that they like to use it. And that's what the authors refer to when they said abuse potential and appeal. And if we want them to substitute for smoking, we need products that are appealing and that have high abuse potential. So the authors themselves concluded, and this is a phrase from the abstract conclusion section, that higher nicotine concentrations and the availability of a variety of flavors in e-cigarettes might facilitate complete substitution for cigarettes. And that's why they raise the issue of regulations that need to take into consideration their impact on smokers. And we know that today, most regulations are oriented, or even plans to regulate are oriented towards flavor restrictions. Another study from the US, from Penn State University, looked at changes in flavor preference over time among, again, adult e-cigarette users. So they followed them up for 4 or 5 years, and they identified that the preference for tobacco and menthol or mint flavors decreased over that period from 40% to 22% at follow-up, almost half the rate. The preference for fruit flavors remained stable, about 1/5 of users, while sweet flavors like chocolate candy and other sweets increased substantially, almost double, basically from 16 to 29% at follow-up. So they were basically the more popular flavors, and tobacco, mint, and menthol were only the third more preferable flavor. Importantly, almost all participants, 98.2, so almost all of them, were using more than one flavor on a regular basis, with only 1 out of 10 reporting that tobacco was their preferred flavor. So they identified the issue with poly-use, poly-flavor use, together, of course, with reporting that it is adults that also like flavors. It's not only adolescents. And the issue of polyflavor use has been identified for a long time. This is a study that we published recently, 1 year ago, while examining almost 70,000 American vapors, and we identified that the two most popular flavor categories were fruit flavors and dessert, pastry, bakery flavors. Both at e-cigarette use initiation in blue bars and at the time of the survey after about 12 to 18 months of use in red bars. And when we looked at former smokers, those who reported that they had quit smoking and that they were using e-cigarettes at the time of quitting smoking, so about 51,500 former smokers. Again, at the time of quitting, fruit and dessert, pastry, bakery flavors were the most popular. This is something, the polyflavor use, that we identified a long time ago. This is a study we published in 2013, so more than 10 years ago. And in fact, we reported that former smokers were less likely to use tobacco and more likely to use sweet and fruit flavors compared to current smokers, that is dual users. So those who have completely quit smoking were more likely to use non-tobacco flavors, and that makes sense. These people want to move away from anything that feels, tastes like tobacco, and that's why they prefer over time different from tobacco flavors. We also identified the issue at that time, 2013, the phenomenon of polyflavor use. The vast majority of participants were using more than one flavor on a regular basis, even daily or within the day. So it's something very common, and these are all adult vapors, as I mentioned before. There are other studies which are showing the impact of non-tobacco flavors on smoking cessation. This is a study from the ITC group, which found that sweet flavors were associated with 60% more likelihood to quit smoking among, again, adult smokers. Another study from the US, the use of non-tobacco flavor was associated with more than 2 times higher chance of quitting smoking compared to the use of tobacco flavors. So it seems that non-tobacco flavors promote smoking cessation, and adults like flavors. In fact, everyone likes flavors, even elderly people. No one wants to taste, smell, or experience something which is odorless or flavorless. It is bland, it is boring, no one likes it. We have seen the effects of flavors in reducing nicotine and smoking cravings, even when simple chewing gums, and I'm not talking about nicotine gums, I'm talking about simple chewing gum, were tested. This is a study that was published 14 years ago, and they were giving chewing gums of different flavors to smokers, and they were checking their nicotine and smoking craving. So they found that some flavors in the gums were more effective in reducing the negative effect associated with nicotine withdrawal. So they said that these flavors may help smokers quit. In that study, apple, cardamom, and vanilla were the 2 flavors that promoted the reduction in nicotine craving and the smoking craving. We should not forget that harm and harm reduction is all about balanced regulation, because in the same way that harm on a population level is related to how hazardous a product is, but also to the level of exposure in the population, harm reduction is how much you reduce the hazard of a product, an alternative product, or an alternative behavior, multiplied by how many people manage to successfully switch from the more harmful to the less harmful behavior or product. One is about fewer toxins, less exposure to toxic and harmful compounds. The other, the issue of use, depends on the attractiveness of the alternative behavior or product to the consumers. And we have 2 cases with very different results. One is nicotine replacement therapies, which is indeed a far lower risk alternative product to smoking tobacco cigarettes, but unfortunately, it has extremely low acceptability and use by the population, particularly, of course, by smokers. And that's why in all studies, especially real-world studies, you see a very, very small, basically a questionable public health benefit of using nicotine replacement therapies, even over the counter, for smoking reduction. At the same time, we have another very successful example, the example of Scandinavian snus in Sweden. This is, of course, again, a very low-risk product, not at the same level of low risk as NRTs. It's a bit more harmful, but at the same time, it is highly acceptable by adult smokers, especially Scandinavia and Sweden. And that is why there is a substantial public health benefit overall in Sweden. It is, in fact, the only smoke-free country in Europe, probably in the world, with a smoking rate of less than 5%, which has already shown benefits from an epidemiological perspective, far lower rates, death rates from cardiovascular disease, lung cancer, and cancer in other organs compared to the average European Union. And that is without reducing nicotine use in the general population, because the rate of nicotine use in Sweden is the same as the average European Union use rate. It's about 23–24%, and not different from the European Union. But what is different is the source of nicotine intake. In the rest of the EU, it is mainly tobacco cigarettes. In Sweden, it is mainly snus. Now, the regulations or the plans to regulate by restricting flavors is expected to have adverse outcomes from a public health perspective. There are studies showing that the more you add restrictions in e-cigarette availability and in flavors accessibility in states in the US, the more the smoking rate increases not only among adults, also among adolescents, even among pregnant women. There are several studies, mainly by the group led by Friedman and Pesco, and they have shown that the more the restrictions, the more people are going to use tobacco cigarettes. And that makes perfect sense because these are substitutes, they work as substitutes, they are competitor products. So if you restrict one, you will end up having more use of the other product. So what makes sense is have less restrictions for the least harmful product and more restrictions for the more harmful product. What the regulators are thinking today doesn't make a lot of sense. So this study, for example, which was published 2 years ago, found that restrictions will result in reduced e-cigarette use, but will increase cigarette use, and it will also create a very strong illicit market. So black market of products that will enter the market completely unregulated, with no quality standards, no safety control, no control from the authorities. And that is a big problem that the regulators need to think before making any decisions. So in conclusion, is really a flavor ban feasible and appropriate? Flavors are very appealing to adults and to adolescents. We're not going to deny that. But the main reason for their existence is that they are very appealing to adult smokers, and particularly former smokers. And adult smokers need appealing smoking substitutes. I hear regulators wanting to make e-cigarette less flavorful, less tasty, less acceptable, but that doesn't make sense. If you make the experience of using a product worse than what it can be, then you limit use of this product by those who simply need it, and that is smokers. We need, as I mentioned, to have a competitive advantage for harm reduction products versus tobacco cigarettes. The opposite makes no sense. And that's why we need risk proportionate regulation. This has been the norm, basically, for any regulatory policy on any consumer or non-consumer product. E-cigarettes are not just consumer products for everyone to use. They serve a role as smoking substitutes. So they have a strong public health prospect. And that's why products need to be appealing for the targeted population. And the appeal of flavors is so strong that a flavor ban, with the exception of tobacco and mint menthol, would be very similar to a de facto ban of electronic cigarettes. But also it may have other unintended consequences. And that is, as I mentioned before, the creation of an uncontrolled black market, because you cannot ban flavors. Flavors are all coming from the food industry, so they will always be available for the market. They will just not be in the market. They will just not be labeled as e-cigarette flavors. There will be no quality standards. There is a potential to use harmful products. For example, food flavorings dissolved in oil, which are perfect to be used in food products, but not to be inhaled. And of course, we will make use and access of these products more complicated for smokers, and smokers are used to a very simple and practical behavior of smoking. So it will, in reality, prevent smokers from using these products to quit, let alone probably cause some relapse of vapors, of former smoking vapors, back to smoking. That's all. Thank you very much.